Hello, everyone.
Good morning.
Good morning.
Good morning. Thank you for waiting.
When you come in, I guess most people are on mute. Also, we'd love to see your faces. You don't have to, but everybody we know is Zoom ready, no matter what you're wearing, no matter how your hair is. No, we've seen it all. Just as long as you're wearing, something, it's always a good idea.
Sure.
Good morning to everybody.
Morning.
Good morning.
Morning.
Good morning.
Hello, good morning, everybody.
Good morning.
Hi.
Thanks. A few more people, we'd love to see your faces.
I don't know how to show my face.
On the bottom, there's a little camera, a little video camera, and you have through it, you press it, and then it'll allow us to see you.
Got it. It says it's unable to detect the camera.
Do you have a camera on there, on your computer?
I sure do.
Okay, then Shmeza, it's on to you. It's beyond my technical ability.
So on the bottom of your screen, sometimes you can see, can you see those little kind of controls, like a mute, a video?
Yes, I do.
And then so go to your video, and there should be a little arrow that says, brings up video settings.
To speaker.
And then you can,
share screen video. Okay, let me see this. Enable. Oh, it says touch up my appearance. I like this.
That's the most important button.
I think I got it. I said enable it.
So enable, but you should also go, there should be a little camera with the colon, I think, and it says, mine says, or it says FaceTime HD camera. I think you can let you pick which camera. You can also go on advanced, but that's a few options. Let me move on to chat so we can get started. We are moving, so just send me a chat and I'll get there and try and connect with you that way.
Thank you.
Awesome, thanks, Anna. Okay, well, we are at 11:35, so Regina, if you're ready to start, I will start with the tech and the introduction.
Go.
Hi everyone, my name is Shmeza. I will be your tech today. I'm with CNM, I'm one of the project coordinators. My pronouns are she, hers. And I'm gonna start off by just giving just a land acknowledgement, letting you all know that this is a safe space, and just acknowledge the Tongva tribe that where CNM is located is part of the California Endowment near downtown, and that is kind of the original land where they once were. We want to acknowledge that. And I'm going to go on to some tech guidelines. We ask that everyone stay muted. We love seeing faces, as Leslie has mentioned, but staying muted just helps us just have a clearer and better presentation. But we do always encourage chat. So please, if you have questions, if you have any feedback, just type it in, and you can ask me anything tech-wise, or if you have anything about the presentation. Leslie is also here as part of the team and will be helping us out, and you can ask her anything as well. We will be having a breakout room today for a few minutes, so you will be leaving this room into another room, but we'll bring you back and let you know when that is happening. On the bottom, you can see all your controls. You can also see reactions and participants. We will be having a time where we will ask questions and ask for feedback, and you can also unmute yourself, but just to avoid some of talking over each other, we do ask that you can raise your hand. You can even do it physically, I'll catch you, or with the little button that's in the participants tab. Awesome, everyone, thank you so much. I am really excited for this, and let me know if you need any help. And I'm gonna hand you off to Regina, who is our CEO. Thank you, Regina.
All right, thanks, Shmeza. Appreciate it. Welcome, everyone. Happy Friday, Juneteenth. And I am excited to share with you some work that we've been a part of over the last several weeks. Some of you may know that the County of Los Angeles created an economic resiliency task force, and we were asked to lead a conversation that focused on the nonprofit and philanthropic sectors. So I assembled a group of amazing people that I'll share their names at the end. But we put some energy into two things. The first was, our assignment was, what will it take for your sector to get back to work? For us, it really wasn't getting back to work. It was really returning to the workplace and what were the barriers, challenges, opportunities, lessons learned. And then the other piece was really about economic resiliency, recovery, and what was it going to take. Now, you guys all know that the last 4 weeks has been a series of events that were going on while we were trying to make these recommendations. So the good news and the bad news is that we were moving very quickly and trying to do the best we can to make recommendations that the County Board of Supervisors could consider working on in the next fiscal year. So I wanted to walk you through what we came up with. And then, as Shmeza mentioned, I thought it would be really valuable. We get one more opportunity next Monday to add any other thoughts that matter most to our sector. So if there's anything that you all feel is valuable that we ought to bring back, we have two opportunities to do that. One is right now in the chat. Want to make sure that you guys in your breakouts give me any feedback that you can, and then I'll take that back to the working group next week, and then we'll figure out if there's any addendums that we want to add to the final product that goes to the supervisors early next week. So with that, I want to run through this and then make sure. Oopsie, it's not advancing, Shmeza, sorry.
Are you using the little control button? Which buttons are you using?
Yeah, arrows up, down.
Arrows. Leslie, how have you shared
I'm so
this
sorry, everybody. This is not a good use of your time. Oh, there we go. Never mind.
Oh, no, there it is. Yeah, sometimes it just lags. Sometimes
okay.
it just lags. Zoom.
Okay. So essentially, what we talked about in summary is that, and you all may know this, that in LA County, our sector serves 31% of the state's poor. We've heard from all of you that there's already been, if we just look at from March, in some cases, 400% increase in demand for services. And we also heard early this spring that that revenue is going down, and that about 20% of you were saying that you were starting to think about closing. What we know is that the scale of the need is growing faster than our capacity to keep up. That we also know that the county does not pay full fare, that we've been talking for several years about this idea of real costs and reimbursement rates, and that foundations were very fast to respond, bringing together $100 million over the last couple months just to take kind of the emergency food, housing, kind of rapid response, crisis intervention dollars that got out into the market very quickly. We also know, and you've told us, that during this window, some of the crisis decisions that were made surfaced some solutions that could be valuable as we think going forward. So we also know that our first question was about how do we return to the workplace safely, and that was complicated and expensive given the services that we provide and the diversity of organizations and clients. So a little reminder, when we started the year, there were 10,000 organizations in LA County providing social services. We know that one of the things that jeopardizes our sector's sustainability is the way that the county contracts. It's an antiquated system, it's an expensive system, and it's an uncoordinated system. That means that we're all spending a lot of work hours trying to figure out how to get the paperwork done, and that's not a good use of time and money at this point. So what we also have heard is that direct service organizations serving the most impacted, which are communities where it's low wage, high rent, very vulnerable, don't trust government right now, depend on nonprofit providers, and that some of the remedies that nonprofit leaders are telling us they're looking at to get through are reducing services, sort of spending less, furloughing people, tapping their reserves. It's kind of a let's just get through it and then we'll worry about next year. But one of the things that emerged as we were talking in my working group was really that this is a pre-existing condition. While COVID really highlights some of the fragility in our sector, that there really is an opportunity now to talk about a more strategic, cost-effective, transformative solution. So we thought we'd go for it. So one of the points that we made is that the nonprofit sector really is addressing so many of the inequities that have gone on, particularly in brown and black communities, with some areas of very high need. Not news to any of you, but what we do know is that some of those direct service providers working in those areas are the most vulnerable. And what we are really hoping is, as we think about where some services going, when we think about dealing with COVID and the return to workplace plan, you were telling us that some services, well, we learned some things about working remotely, and in some cases it worked very well. In other cases, it was difficult to do the sort of social distancing county protocols that would be vital to keep people safe. So the idea of single parents with kids, mental health disorders, people with disabilities, people that don't know that they're supposed to bring their masks and gloves if they had them. So the first issue that we wanted to tackle for the supervisors, unique to our sector, is that not all organizations have the same level of preparedness and infrastructure to return to the workplace. Many of you told us that you won't be ready before 2020, that you were feeling that there was going to be a concern for employee safety and end user safety, that there were real issues and confusion around what the state and the county was telling us about what's safe, what the protocols look like. But there was also the practical liability issues for employers, and that we needed some clear guidance around that and some protections around that. So one of the things that turned up is the idea of either it's difficult to get the PPEs or it's really difficult to pay for the sanitation equipment, not only the sort of sneeze guards and face masks, but also for big locations to do some of the sanitation on a larger scale, that we didn't really budget for any of that, even if you could get it. So what I mentioned that many jobs can be done at home, but it's dependent on the school system, reliable daycare, and access to technology. And we know that the communities that were disproportionately impacted should be where the county really thinks about aligning resources. So then shifting gears to economic recovery and meeting needs, to reinforce the idea that the scale is big. Most of the financial projections, if we're thinking about public dollars, are that the next couple of years are going to be difficult, and that we really need to look at improved coordination and cost savings. You may know, some of you may know, that in 2015, there was a huge push to talk about real costs and how to reduce the administrative burden, both on the county, because they also spend a lot of staff time on kind of the administrative oversight of our contracts, but that we do too. So the idea of unnecessary expense and contracting inefficiencies. So we felt it was important to recognize that we're in a big, complicated county, and that between what the city, county, and state are trying to accomplish, as well as where philanthropy is investing time and money, that there were some inefficiencies for all of us. So what we felt might help on the public side was really looking at kind of a community-wide system of care. But in the meantime, while the county is thinking about ways to spend money, that we create some sort of block grant style approaches to give organizations more opportunities to respond to needs and less oversight time for the county. Really thinking about, would there be pools of emergency aid that might be available to organizations working in those vulnerable communities. Also sort of thinking about a pooled loan fund, a real opportunity to consider the muscle of the county to subsidize PPEs. But we felt that it was really important that we have data, that we set goals, and that we really think about how we're going to track. And then relax some, at least for the next 2 years, potentially relax some of the reporting burden. And then to think about AB5, the exemption there. So some of this is going to be redundant with things that we talked about, but in the way that the supervisors wanted to see sort of short-term and long-term, we tried to divide up things that we'd like to see immediately versus things that we'd like to see in the next 3 to 5 years. So one of the things that came up was this idea of kind of reopening kits, that if the county could help secure some of the sort of group buying and then help us get started with PPEs, high-powered equipment, floor decals, sneeze guards. Some of you know that the HEROES Act out of Washington, D.C. kind of creates some protection for employers so that the liability from the pandemic doesn't get in the way of providing services as we're trying to figure this all out. Also to capture lessons learned, both in terms of the pandemic, but also going forward when the next emergency comes, to make sure that we capture what we've learned so that we don't have to try it all again. Hopefully to give some flexibility around liabilities related to referrals for service providers, and work with the community-based groups and the Center for Nonprofit Management to map what's happening with nonprofit organizations, mapping the closing, assessing needs, trying to overlay what's happening, where money's going if it's happening in the most vulnerable neighborhoods. But we also thought it might be a great idea, since we're kind of all hoping that real change happens, that we need to commit to being accountable for linking services in areas of greatest need. So we called them Resiliency Hubs. So, you know, we put in an appeal to simplify the application process. We asked that we think about, rather than waiting months to be reimbursed, that there was kind of a payment schedule to help with startup and then cover more of the overhead. It turns out that some of our contracts, that sort of overhead rate can be as low as 0%, can be as high as 15%, but in the for-profit service sector, they're getting 30, 35%. So we think there's definitely room to improve. We also think that it would be an interesting opportunity for the county to create incentives for collaborative efforts, that we really look at collective impact and really look at all the talents that we have around LA County and see what we might be able to leverage in terms of public-private partnerships, really focused on greater impact and reach. And then we were hoping that the supervisors would direct the CEO to include at the director level how they contract to provide social services. We thought it would be a really great opportunity for people to get focused on, you know, common goals and measuring against those goals. So longer term, which we kind of defined as a 3 to 5 year window, we thought it was really important to take a look at data. To then really look at shared goals in communities. We thought it was important that at this moment that they listen to community groups, both to think about better coordination, but also what to measure that would be meaningful. So as we think about that sort of block grant strategy, looking at efficiencies and flexibility and savings, we also thought it was a really important opportunity to take a look at how maybe some of the smaller organizations who wouldn't have access typically to government grants might have some sort of entry-level funding opportunities. We know right now that in lots of neighborhoods, government is not going to be a safe space, and that nonprofits are trusted resources and allies in areas of community need. So again, this the important role that public-private partnerships could play in accessing technology, making it as easy as possible for families to do sort of one-stop shopping and find the help that they need. And then the full cost contracting that also links to equitable wages and benefits for people working in the nonprofits. So, you know, in our wish list, we also thought that it would be great if we could, or the county could, have a more centralized website to help consumers apply for county human services, that community-based organizations could communicate, and that staff could link their contracts. So we know all of this is a big, hairy wish, but we thought it was worth a try. So long term, we thought we would also ask them to consider things that might help our sector, because ultimately our assignment was what would help the nonprofit sector be more sustainable and effective. So we thought there were some things that, things like workforce incentives, debt forgiveness, student loan forgiveness, if we could keep people in the nonprofit sector working in high need communities. That maybe we could, if we came up with some great ideas, that philanthropy, as always, is more interested in serving to help partner on pilots, new ideas that then the county could bring to scale. But really with a goal of, wherever possible, create a more efficient service delivery model, and then really underscore the unique relationship that we have in the nonprofit sector, essentially as the workforce for the county. So our goal was, given that the current system is fragmented and labor intensive, we felt that the staff within the county has done some homework around other systems that have worked around the country. And if they did move to a more mechanized program, they could save 1% on a conservative estimate, and so that the savings might offset the investment. So we thought that it might be, we couldn't come up with a cool idea in terms of a name, but kind of a blue ribbon approach that invites agencies to weigh in on funding priorities and accountability metrics, that we think about public-private partnerships, and also to look at kind of the intellectual capital that's all over our region. We are a very successful economy, and thought that, how do we tap some of the, you know, Silicon Beach types and some of the successful business leaders and bring everyone into the fold to try and tackle some of these social issues with all of the mental muscle that we have around the community to help nonprofits succeed. We expect, you know, that there's a lot of energy right now around this emergency, but we know from the past that that's not a sustainable model. We expect that there'll be donor fatigue. We also know that as the stock market kind of bounces around, that and more jobs are lost, that there are just not going to be the same financial resources available. So we've got to get ready for that. We also know that it's going to be important that we think about, you know, we're coming up on fire season again, and that communities depend on nonprofits to be ready for that. So as we think about our role, you know, it's kind of three-dimensional chess right now, but we felt it was really important that we also consider this to be a moment in time where let's just recognize that some of the systems are getting in the way, and that, you know, let's be bold and try something new. So I wanted you to see who was on the task force, an amazing group of smart people that represent a lot of different points of view, as you can imagine, and we tried to take all of their perspectives and turn that into the document that you just saw. Last Tuesday, we presented this information in a little better organized form to try and really call out a couple of key themes that really were about, let's look for some efficiencies, that we all want to do our best not to slow the spread of the virus, to keep the public and our workforce safe, but that we also feel like this is an exciting time to reimagine what's possible and then work together for the good of our community. So with that in mind, what would be really helpful to me is I wanted to give you all a chance to talk among yourselves. So we're going to do maybe groups of 4 or 5 people in the room. And, you know, I know that that was a lot to absorb very quickly, but curious if you feel like we covered the bases that are most significant for you as you think ahead about both the, you know, sort of safe return to work strategy and the what would help our sector have greater impact and sustainability going forward. So wanted to give you about 10 minutes to talk among yourselves. And then what I was hoping is that you would identify in your groups a spokesperson that would let us know what ideas came up, any feedback, if you think that this is, you know, if we got the, you know, if we hit the right notes, if there are things that you feel we left off, would really appreciate any thoughts on that. And then we'll collect all of that and then let you go have lunch. So Shmeza, you're gonna turn everybody into small work groups.
Yeah, so I will be starting the breakout rooms. Leslie and Regina, you don't have to join, but you can. There gives you an option to join. So in this room, it'll be for about 10 minutes. I will let you know when I close the room. So it'll take you 60 seconds till it closes and you'll get brought back over here. So, okay, everyone. See you in a bit. Goodbye. I just put her in the waiting room. I don't know what else to.
She didn't do it because mine, I automatically went. I didn't touch it and it sent me in a room.
Oh, that's weird. Well, Regina can't leave it now, I guess. So.
Yes, she can.
She doesn't know how, probably, though. Yeah, you know what I'm saying? Do you want to, let's see. Oh, weird. I don't know why. I have to look at that. I've been struggling with the breakout rooms.
Well, so much for 360 people.
Oh my gosh, right? Oh my gosh.
Now Regina's going to say, well, Erin could do it alone. How come Shmesa couldn't do it alone?
Well, I didn't know that she wanted me to do that, you know? Oh.
Okay.
Whatever. I'm glad that she's learning to share her screen.
Yeah, big step.
That is a big step. I mean, then she won't need anyone besides, like, it's good to help. It's good to have help. Hey, Meg.
Hi, the 2 people in my room seem to be MIA.
Oh no, okay, yeah, that happens. Let me move you to a different room.
Oh, thank you. I was like, oh, no
Yeah.
one's talking.
Oh no, yeah, that's a problem. Is sometimes, let me see if I can move you. Give me 1 second. Okay.
How'd she get out?
I don't know. I don't know how to put her in a breakout room here.
She wasn't in one before?
Huh?
Did you put her in one?
But no, I'm trying to move her in. Let's see. Where's
she now?
She's in here. I'm trying to find you how to put you back into a breakout room. I don't know. Yeah, we
go,
were like,
go up to her name and it should say move. You go into her.
It doesn't say that, yeah. It says put in waiting room. That's why this is weird, this breakout session that.
Put in waiting room.
Yeah, then she's just in the waiting room. That is so weird. I'm trying to do it from the breakout session. You should be able to.
Yeah.
Okay, let's see. So sorry, Megan. That's so weird. I wonder what group you were in. Oh, you were in with Liliana and Marcia.
So go to her name in the group. Go to her name in the group and then move her.
Okay, move to. There you go. See? This is why Leslie's on here, Megan. She's so good. Okay, we're gonna move you to Breakout Room 2. Goodbye. Thank you, Megan. Okay.
Are you on the phone separate from on your computer?
No.
Okay.
That's so weird. It should have you be, it says you're not joined. Did it ask you to join?
Did it come on your screen? And then you should click on it.
Oh, no, nothing is on my screen besides you guys and
That,
It's not hidden?
and now Relly. That
It's
is
not
so
hidden
weird. Okay,
on
okay, okay.
Ah, I found it.
Okay.
Thank you.
Assign to.
How long they've been in the groups? You've been timing it?
Yeah, I'm timing it.
There's somebody else coming in.
I'll tell them because I didn't tell this person, last person. Hi, is it Trina? Hi, just to let you know, we're in the middle of some breakout rooms. So
Oh.
I can throw you in and basically just talking about the workout. So if you want to just come in and go in and just listen, you can just say, hey, I'm just going to listen in and see what caught up.
Sure.
Okay?
I got wrapped up in the project that I'm working on. I totally lost track of time.
Yeah, no worries about it. I'm going to put you in a great, just check it out. I think they're
you.
just going to be discussing it. So. I just think it's going to be cool to have all of us try and do these some at least Zoom a summer session, you know, or so, it just had not. I mean, of course, not everyone has to, but it just be good so everyone knows how to do this. You know, be super versatile. It's not hard, and we're in an age now, like an age of this COVID cycle where people are kind of like, we know what it's like now. Zoom, like you said, Zoom ready. It's just. So they actually went at 12, so give me. Hello, everyone. Welcome back. Regina, you got sucked into a break room.
I did. It's always fun to hear what people are up to. So,
Nice.
so we want to hear what you all were talking about in your breakout rooms. So who wants to go first? Curious what you guys, any feedback that came out of the breakouts.
So I'll break the ice, Regina.
Good
It's
job.
Mike.
Counting on you.
So we had 4 people in our breakout room, but one got called away, one never spoke. And so it was 2 of us, and we're sort of, interestingly enough, at opposite ends of the spectrum, both in terms of services offered and in terms of size of organizations. So as you know, I'm the CEO of Child Care Resource Center, really large organization, big budget, 1,000 staff across a whole large area. And then Cindy is in the southeast area and is doing volunteer hospice services, and then some kids services, but a really small organization. My organization has 2 contracts with the county, one where there are 10 of us that negotiate as basically as a bargaining unit with the Department of Public Social Services, a really large contract. And then another contract that goes through the Child Care Alliance, of which I'm the chair, but also we negotiate with Department of Children and Family Services. And so some of the stuff that you said about differences between county departments is just maddening, in which when you point out to the one group that DCFS, that DPSS doesn't do it that way, they say, well, that's not who we are. And so, you know, you have to be, and a lot of times they fall back on its state guidelines. And when you talk to the state, they say, oh, no, we don't have those guidelines. The county just uses that when it's convenient for them to try to nail you to the wall, to be honest with you. So we have a contract with DPSS that we're in the 3rd year of, so it needs to be renegotiated. And this is not a good year to be renegotiating contracts because we actually don't know. So one recommendation that I would have is that we extend contracts and not have any renegotiations in the 2021 fiscal year, just because of the unpredictability. The other issues that we're encountering is that because the economy was getting better and we were working with, to extend contracts, not offer any negotiations. Thank you. And then the other one was this last year, because of the way that the state changed some requirements, we all of a sudden saw an increase in revenue from the county, but we can't carry it over without getting their permission to carry it over. And so we have some fairly significant surpluses, but we're anticipating that we're going to see reductions next year, and we need to be able to carry over the funds, which is not, the department is not particularly helpful in us doing that. The other part in terms of our negotiations was the county was not particularly amenable to the increases in minimum wage. And so, you know, when minimum wage happens, there's upward pressure on all portions of our organization in terms of having to pay, you know, supervisors more and all that. But the county didn't recognize that as being an issue. The COVID we did end up with a city, county, private sector response in terms of childcare, in which we were able to work some things that had never, you know, the fact that the city and county actually sat down at the table and came up with a joint agreement on things in this environment was really pretty amazing. This is the city of LA. And so it seems to me that there are other partners that could be brought to the table, just in terms of the early childhood. First 5 LA, which is a funder, but also you know, funds a lot of programs. Getting LA County Office of Ed to the table, school districts. We're encountering an issue with LA Unified because of the way that they're having to social distance, where we've had a number of Head Start programs on their school sites where we don't think we're going to be able to continue that. So that's an issue. And then looking at the list of people on your task force, I only saw one that I recognized from the San Fernando Valley, saw no one from the Antelope Valley, and only saw one early childhood person, which was Martine Singer at Institute International. So you know, we have some challenges, especially in the Antelope Valley, which we serve, where you would have a really hard time with a resiliency hub because there's hardly any infrastructure out there.
Yeah.
We're actually moving some of our Head Start resources to the Antelope Valley this next year because we have to move them somewhere, and that's actually where a lot of the kids are going to be in the future. So, you know, it's really hard to engage with folks from the Antelope Valley because there's just not that many of us up there. But you really have to, because it's always an under-resourced, and the county forgets about us, and there was that kind of stuff going on. So, and then one of the things that Cindy talked about was that because of the way they are structured, they have issues around not being able to charge for the services that they provide because of, I guess it's Medi-Cal, and Cindy, maybe you can type in the chat room on that.
Yeah, because being a volunteer model hospice, we have different rules than the Medicare certified folks, and it's a lengthy explanation, but the reality is that I think I was commenting on the fact that I don't contract with the county very much because I don't have the infrastructure to fight the battles and play the games. And I did have a very small one time for a pilot project and about killed me. And so we haven't gone back, but I do have friends and colleagues who contract with them. And I think what you hit on, Regina, is just they could offload the admin overhead and some of the things Mike just described, the inconsistencies. It just feels like there's so much energy and cost put into county staff. I was going to say, I would say overseen, because I don't know what they're overseeing, because they seem to not see things that are very logical and that are common sense. So I don't want to go down that path, but that's what we're saying.
Got it.
So,
Yeah.
Grace,
So Regina, I'll just add one last thing, which is that DPSS comes out and audits us 4 times a year. I mean, we end up setting aside, well, up until recently, we end up setting aside an office for the people to come in and audit, and they want to see the documents. Then we have Department of Children and Family. Oh, you know what? We also have a DPH contract. I forgot that. So we have DPSS auditing us. We have DCFS auditing us. We have DPH auditing us. And then we have First 5 LA auditing us. So we basically have to assign somebody almost full time just to service all these folks coming into auditing us. And half the time they're looking for the exact same information.
Got it. Okay. So that's really helpful. Thanks, you guys. So let's hear from another group. What can we build on some of what Mike and Cindy talked about? Anything else come out? Who's another room we should hear from?
Well, this is Leanne. I can share a little bit about in our room. First of all, we said, thank you so much, Regina, for sharing all of this. We thought it was really amazing. We said you talked so fast and went through so much information that we said we actually would love to be able to, if we could get the slides and give you a feedback, you know, in a couple of days, because there was just so much information. So I think those of us in the room, there were 3 of us, we kind of all picked up on like specific pieces of information that just kind of, you know, touched us. So I know, like for me, I have a nonprofit around STEM Advantage, around science, technology, engineering, and math for the CSU students. So when you talked about like the short-term recommendations, I had even I took a quick screenshot of like provide incentives for collaborative efforts in partnership with foundations to focus on collective impact to better leverage public-private investment for greater impact and reach. We talk about that a lot, and I was just sharing with the group how even this morning I just had a call with somebody from the LA Chamber of Commerce, because they have what's called Pixel Exchange, but they don't work so much with the CSUs. They work with different students, and they have some companies who are more interested in students with, like, you know, more skills. So we said there could be just a great collaboration there to make sure that, you know, we're working together to serve a couple of other students, and because they think many of their partners would really like the skills that our students have. So we already have done additional introductions and everything kind of as a result of that call. So I thought that type of thing was really good, because I do think, you know, there's just so many opportunities for collaboration and so many different nonprofits out there. And the more we can, you know, talk about collective impact, and if there are some incentives, you know, in terms of how we can really do that, you know, step back and do that effectively, because then you might need some additional resources for the collaboration, but I think the impact would really be worth it. So like that's one of the things that I really picked up on. And then Megan, I'll turn it to you if you want to share, you know, because you picked up on another point.
Yeah, the piece that hit me most was when you were talking about the way philanthropy currently works.
Megan, can you speak up? Because I don't know if
Is it
it's
hard
your
to hear?
audio or mine.
Can't hear her.
Go for it. Now it's muted.
Megan, we could hear you in our group. So whatever you were doing when you were talking to us, we could hear you. But she's putting it in chat, it looks like.
Got it.
Okay.
All right.
Regina, can I jump in?
Go for it.
So I don't think Farhan's able to be on the call, but he works for Bank of America. And for those who know me, I have a background in fundraising and working with philanthropy. And so we got into DAFs. We sort of keying off what Megan and was talking about here and resources. One small positive sign I've seen, having lived through 2008, which many of us on this call have, I see a different call to action with getting more money from DAFs out the door, which I think is great. And I expressed to him my concern that traditionally the financial institutions that manage the bulk of the DAFs have not been staffed to really have a good understanding of community needs in helping their donors get the money out the door beyond sort of the most obvious places. And we got sort of, and he was all excited. We're going to continue the conversation offline. He was excited to talk about that. We kind of got called, you know, we had to come back into the broader group. But yeah, I think my hope is I've seen philanthropy talking differently and making some different choices, like the debt bond that Ford just issued. But this is really a moment not just to talk about what nonprofits are going to do differently in responding, but how are we going to fund them differently? How are we going to really make some structural change? Because it's going to take that.
Right. Well, thank you.
Yeah.
Yeah, and Regina, I wanted to know, I just want to highlight what Megan said. She did put in the chat, and which is one thing our group talked about was having serious conversations about changing the philanthropic system. Not only is funding hard to get because the pool is so small, but the restrictions placed on how the funding is used once received often makes it difficult for nonprofits to carry out the programs they would know would have the most impact. A new system where the stakeholders, nonprofits, apply for funds, and communities who would be impacted by the work have a large influence in how funds are distributed, i.e. a communing approach would be helpful.
Yeah. Yeah. We were only lucky, Megan, that our assignment was to make recommendations to the county. That's why I'm laughing. We have lots of wishes about recommendations on how the corporate world should work and how philanthropy should work and how, but you know, it sure seems like there's some real energy right now around looking at what could be happening quickly, you know, and I think one of the things that we tried to call out is that, you know, after this moment when everyone's all excited, what happens next? And that's going to still be the nonprofit sector getting the work done. So we were hoping to sort of look at kind of macro targets that might have a longer term footprint. We won't get everything we asked for, but we thought we wanted to help them. And to your point, I think, help them focus on the things that mattered most to the work of our sector. And how the money is, and all that, Mike, as you were talking about, all the time that gets spent, on audits and paperwork and oversight. If you just could imagine the math of, if we could get some of those hours back, that actually creates work that helps people. There's something really exciting about that at a time when they're, and to be fair, the county's looking at reductions as well. And so they're trying to figure out how to, I'm really glad all we have to do is recommend. We don't have to solve it for them, because they are making hard choices with the dollars that they have, but they got a lot of dollars. So we're going to help them think about that. So is there another group? We have a couple more minutes. I want to make sure if there's some other thoughts that you guys, yeah, trust. Yeah. Any other group that wants to weigh in? I'd love to. It's been all really, really valuable, and appreciate the thoughts in the chat.
I joined late, so I apologize for being late, but my only thought was, I assume that, these recommendations are, right now, but are they also considering the 1 to 3 year plan? Because obviously, as we go up and down in all of this, service is obviously bigger for the nonprofit sector. We never stop. So, is part of the recommendation for county officials and those at that level to think of this more of as a 1 to 3 year recovery plan? Or is it just, can we get through 2020?
Great question, and thanks for asking that.
Sure.
They asked us for short, medium, and long-term recommendations.
Okay.
And given the current climate, the short term is on everyone's mind, but they are asking longer term ideas. So what was nice for us is that one couldn't really separate from the other, really, that the things that are getting in the way today will get in the way later, right? Or if we could start to tackle some of that, come at it differently, might open up some opportunities going forward, so there was no getting around a couple of things. The sort of, equity, social justice piece, in many nonprofits, unlike other parts of our sector, we would like to be out of work. We'd like to put ourselves out of work. And we're not trying to grow, it responds to a need. So we're in a unique position, right? We also provide services that the county counts on for their residents. So we have a unique role, and the supervisors were very clear about that we're, as a sector, in a unique space. We also need to remember that, philanthropy is about 7% of this big machine, that government is a big funder, and that we're also in an environment with lots of wealthy people that want to do good things. So, it's a great time to be thinking outside of the box. And we just felt it was really important, as you mentioned, Mike, we had a lot of perspectives around the table, but part of the challenge is, what do we want to, if we give them everything, then we won't get anything, right? That if we can really prioritize a couple of things that we thought would be most meaningful, and keep everyone focused on, if our sector thinks that would make the biggest difference, then let's just repeat that, and not end up competing with ourselves when we're asking them to think differently. So, or at least consider some things. So, is there anybody else that wants to add? Lawrence has his hand up.
Yeah.
Lawrence has his hand up.
I think we, talked about a lot of those things, but one idea that I came up with was finding a way for the smaller organizations to be able to reach some of these celebrities who are doing a lot of good work, finding a way to explain what they're doing to these people. So let's say you do something for cancer. At the end of their piece, could there be a way where here are 5 or 6 organizations in LA that you can contact for more information? Here's how to do things. The politicians follow the celebrities. They really do. So we got to look for the good guys, find ways to expand their interest, and maybe we can get a lot of bang for our buck.
Right. Well, let's hope that all works. It does seem like right now there's a lot of interest in helping and investing as they can. And I really appreciate that you guys spent this hour with us. I really took a lot of notes, and we'll take it all back to the work group and add some stuff. You guys should know that this assignment we had thought we had through the middle of July, and they shortened our deadline by a month. So we all know what that's like when you think you have time to do more data collection or some thinking, and the window went from 6 weeks to 10 days in the midst of what's happening right now. So I am really grateful to all of you to help us think, and shared that with you, because as you know, you look at the people in the working group, they're all really busy people too. And they're all doing a lot of things right now, and they took the time to do this assignment with me. So I really appreciate all that you contributed and all that they helped us gather. And we'll submit our addendum next week, and then the next big piece though, you guys, that we'll keep you posted, but I think it's going to be really, really important to keep the pressure on the supervisors. If there are things that we talked about that you think are valuable, please communicate that to the people that represent you. You know, if they know that this is meaningful for you, let's keep reminding them. We have 1 million people in our workforce in LA County. That's a voter block, and our voices matter right now. So we are going to communicate with Philanthropy next week as it gets closer to action that the supervisors are going to take. And then we'll keep communicating with you. And then I hope that you communicate with your networks, because we want to make sure that, you know, they hear from us around this stuff, and not let these good ideas go to waste if there's a way to activate some of them. So
Thank you, Regina.
yeah, you're welcome.
Smeza and team, thank you guys.
Thank you. Regina, just to, we will be sending them the PowerPoint as well. Can we send them?
Yep.
Perfect. And I will send you that, and this
Yep,
will be
it's a public
recorded.
document. Yep.
Perfect. Awesome. And we'll have us recorded on our website as well, and you can access this later.
Okay.
Thank
Thanks,
you all.
everybody.
Thank you so much. Bye.